Diabetes mellitus, commonly called as diabetes, is a metabolic disorder characterized by rise in blood sugar level for a prolonged period of time. Globally, around 9.3% of the world population is affected by diabetes. India is deemed as the world's capital of diabetes, with 11.8% of its population being affected. Approximately 1.5 million people die due to diabetes. Risk factors of diabetes: obesity, physical inactivity, high cholesterol level, high blood pressure, smoking, and family history. Diabetes are further classified as Type 1, where there is a complete insulin deficiency, Type 2 due to relative insulin deficiency, and other variants such as drug-induced, hormonal disorder, genetic disorder, and gestational diabetes. Clinical presentation of diabetes include excessive thirst, excessive hunger and urination, loss of sensation, frequent skin infection, unexplained weight loss, changes in vision, and weakness, malaise, and irritability. Signs to look for in a diabetic patient: burning mouth, dry mouth, poor wound healing capacity, bilateral salivary gland enlargement, high risk of caries, and increased severity of gum disease and loosening of teeth. Oral health care of a diabetic patient must include visit to a dentist every 6 months, brushing teeth twice a day, flossing regularly, and reducing the amount of intake of sugar drinks, junk food and refined carbs, and reading the labels for hidden sugar. Complications during dental treatment: hypoglycemia, a state where there is reduce in blood sugar levels, which is caused due to too little food, too much insulin or diabetic medicine, or extra exercise, which causes confusion, sweating, tremor, anxiety, tingling, and palpitation. Another complication is hyperglycemia, where there is rise in blood sugar level, which is caused due to too much food or too little insulin or diabetic medicine. The symptoms are nausea, blurred vision, and drowsiness. Oral complications during dental treatment if the patient is uncontrolled diabetic include infection, poor wound healing, rapid loosening of teeth. Extraction of tooth or any surgical procedure is not advised in case of high blood sugar. Tests done for the diagnosis of diabetes: HbA1c test, which measures the blood sugar values over a period of 2 to 3 months. Normal value is below 5.7. Pre-diabetic ranges from 5.7 to 6.4%, whereas diabetic is 6.5% or above. Random blood sugar levels are also tested. Average value is 160 mg per deciliter, above which the patient is termed as diabetic. Prevention is better than cure. Diabetes can be prevented by having a balanced diet, exercising regularly, and drinking 3 liters of water per day. For a successful treatment, before treatment, good glycemic control must be maintained. Appointments must be given in the morning. Avoid alcohol consumption and smoking. And after treatment, total caloric and protein fat ratio must be maintained. Avoid cigarette smoking. Sufficient oral care should be given. Regular visit to the physician and monitoring of blood glucose must be done.